Hello, everybody. It's John Scanlon with the Irish Hypnotherapy Conference, and welcome to our podcast this week. And this week we have Dr. Sue Peacock. Sue, how are you?
Thanks. How are you?
Great. It's a beautiful sunny morning here, so we'll take that while we have it. So you're speaking in Dublin in April, which is actually only about 8 weeks away now. So do you want to give people just a who is Sue Peacock?
Yeah. Okay. Well, first of all, thank you for inviting me to Dublin. I'm hugely looking forward to it, and what a fabulous array of speakers you've got lined up for everyone. So it's going to be great.
It's going to be fantastic. It really is.
So a little bit about me then. I'm Dr. Sue Peacock. I'm a consultant health psychologist. Because I'm a psychologist, I have to be regulated by the Health and Care Professions Council. I'm chartered with the British Psychological Society. I've been doing hypnotherapy for about 12 years now. Um, I've been a psychologist for about 25 years, but I was new to hypnotherapy because it was so great. It drew me in. Um, my main areas of work are long-term health conditions, so things like pain or cancer or respiratory illnesses, anything that's a long-term health condition. And of course, working with long-term health conditions, they aren't always the issue, are they? Because the emotional aspect that kind of goes with it. So the anxiety, the depression, the loneliness, and all of those kind of things. Um, I've got academic sort of research background as well, so I've sort of published in academic journals, but more importantly, I've published in sort of media, so everybody can see stuff. And
Everyone breathes.
kind of just focus on that kind of thing. So it's been in sort of national press and bits and pieces, and I've authored some books. So that's kind of me in a nutshell, really.
Well, anything that promotes the profession, including national media and books and all that, is really good. Um, because one of the objectives of the conference is to kind of demystify hypnosis. I mean, for the general public on one hand, but also for the medical profession on the other, because where we see the power of it. And I know from talking to Gary Coles, getting the research and evidence that research in the standard way is more complicated than it would be for a normal type of medical intervention. Um, but we all know the power, and we've all seen those transformations that have taken place. Not everyone transforms. There's other reasons that go on behind it, but in general, people benefit, and all the research will indicate, there's a lot more benefit. So, how did you get find your way to hypnotherapy then?
That's a good question. I used to work, well, I worked for 20 odd years in a pain clinic, in an NHS pain clinic. And, being a psychologist back then, we basically had CBT and a few little other bits. And yes, it was a good tool for some people, but I used to think, well, there must be something much more than this. So I kind of did a little bit of research and thought, oh, hypnotherapy sounds quite interesting. Although I have to say at that time I was a massive skeptic.
Right.
So I thought, oh, right, okay, let's go and find out a little bit more about it. So I kind of did a bit, looking online and stuff like that, and see what it was about. And then I went and joined a course that was specifically for sort of health professionals, and that was sort of a weekend thing for, I think it was every month for about 10 months or something like that.
Hmm.
So quite good, quite intense. It was quite fun. And then I kind of started to use that a little bit in my clinics and got quite good results and thought, oh, this is all right.
Right.
And so I sort of started using it a bit more and talking about it a little bit more. I think being the only psychologist in the pain clinic at that particular time, nobody really knew what psychology was anyway. So it was quite good from that point of view, really. And the consultants was, consultant anaesthetist started to think, oh, that's quite good. That's quite interesting. And then yeah, so I kind of just grew my confidence really in my NHS practice, and then I sort of started to develop a little bit of a private practice. Started in my private practice to do a little bit more sort of
Mhm.
hypnotherapy stuff. And then when I left the NHS, which must be about 7 years ago, I guess now, I decided that I had to go on Carl's course, Carl
Right.
Smith. Whoa, what an eye opener that was. It was probably it just totally changed my lack of confidence into being quite confident about doing it, and not sort of thinking, "Well, I hope this is gonna work,"
Yeah.
whereas it's gonna work. So it was a good course. So yes, that's really what got me into hypnotherapy. Is I wasn't able to give the best to my pain patients, and I wanted to give them more. So
Right. Okay. So it's mainly in the areas of pain, anxiety, and depression that you work, is it, or is there more?
I do quite a lot of work with insomnia and
Okay.
incontinence, things like that. So anything sort of medical related kind of.
With an emotional root is probably the best way to describe it, is it?
Yeah,
Okay.
absolutely. Yeah.
Um, and in Dublin, your talk is on depressions.
Yes. 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 I'm talking about depression. Looking forward to it because it's one of those rising topics, isn't it? Particularly since the pandemic.
Yeah.
It's gone up huge amounts here since the pandemic. I not just reflected in my own practice, but even people that I talk to, we're getting lots more referrals for depression and anxiety, as I'm sure you do.
Yeah.
And
Yeah.
the latest figures they had was about 2022, I think, and they were saying that one in six adults in the UK were experiencing depression. So
That's very significant. I'm not sure what the numbers are here, but they wouldn't be too dissimilar anyway. Um, what think? Do you think loneliness has a part to play in that?
yes, I think it has a huge part to play. I think a lot of the people that I do see, particularly sort of the people with long-term health conditions, they seem to be particularly isolated, partly because of the pandemic, because things like support groups kind of weren't able to meet and things. I know the one I run wasn't able to meet, and nobody really wanted to do it online because everyone thought, oh no, I want
Yes.
to.
Took a while to get people to change to that. Yeah.
So yeah, now I'm pretty much all online, but back then I remember thinking, oh, it's only gonna be for a few months, it'll be fine. But yeah, so I think that loneliness aspect, because a lot of the people who were particularly in my support group as such, they wouldn't really go online. So it's been a real hard slog to try and get it back to how it was. In fact, it isn't back. We still don't have the numbers that we used to have. We used to have about 50, 60 people attending. Now we have about 20. So it's changed. I think the fact that social media makes us so connected but so distant in some ways, doesn't it? It's one of those things,
Very true.
and I
It does
think
allow us to be connected, and you can connect with people from all over the world. But there's not the physical connection. And the reason I asked was particularly during COVID, that whole thing of isolation and the mental health impact of isolation, and even terms like social distancing and physical distancing and all those kind of, and I know it was all done with the best intention, but the power of language is obviously, it increased those feelings of isolation. Not only could you not see somebody, but you had to be
opportunity,
socially distant from them, not physically distant, socially distant, you know.
absolutely, and there's just that sort of the friendships that were kind of missed or didn't blossom as well as they could have, or nobody seems to have, in terms of just thinking about my support group as an example, nobody seems to have gone back to how it used to be.
Right.
Um, I mean, they're still friendly and they're still, they're just about giving each other hugs now, whereas it used to be all the
Right.
time.
Okay. Yeah.
And there's not quite so much regular meeting outside the group as there used to be and things. But it is slowly getting better, and I think I suppose because we were told to stay at home and stay inside for so long, we kind of come conditioned to it, and kind of have to unlearn it again, don't we?
Yeah, and I think particularly for the more vulnerable, that's the case, for those who would experience that the most. I think for most of us, it's kind of back to normal every day. I know for me it is anyway, but and I think COVID is such a long distant memory at this stage, but the impact of it is there, and we're dealing with it all the time. Um, in terms of hypnosis in the medical profession in the UK, how is that perceived?
I think it's improving slowly. I think, people like Gary Coles are doing a fabulous job in getting it out there. There's an organisation here who I can never remember what they're called. I think they're called British Society of Clinical and Academic Hypnotherapists.
Right.
basically a group of people who are health professionals who are trying to get hypnosis into more medical
Hmm.
hospitals, and me more accepting to healthcare professionals. Um, they do quite a lot of talks, particularly with anaesthetists,
Right.
because I guess pain and anaesthesia is probably quite a good way in, because it works, doesn't it? And there's lots of
Yeah.
evidence. And there is lots. The good thing is, there is lots of evidence out there, isn't there, for hypnotherapy now, and it seems to be a growing body. So if we can kind of hold up the flag and say, well, this paper said this, and this paper said this, they're more likely to take it on board, aren't they? So that makes it much, much
Yeah.
better.
Yeah. That's actually a really interesting point, not just for the medical profession, but for hypnotherapists in general, in terms of using research in marketing and advertising. And I'm not thinking specifically of weight loss. I'm thinking more of the anxiety, stroke, depression type, or um, which is something that, yeah, I think we should all think about. Um, because there is Google Scholar will give you a whole lot of information if you go look for it.
There's surprisingly more out there than you think there's going to be.
Yeah, I had a look there a little while ago, and I thought, wow, now there was so much there. I wasn't going delving into each and every article, but you can put it in for anything that you need.
Think it's always a good thing. I always think if you're going to be talking to sort of the medical profession, health profession, then because they kind of come from that evidence-based
Yeah,
background, and if we can provide the facts and figures and say, well, this is proved to work, and then you have to say, well, it's only 20 people they tried it on, but hey, that's 20 people. So,
absolutely. Um, and so actually, like if a hypnotherapist was writing to the doctors in their local area, for instance, it may be just to pull that piece of research that would show that in their area of speciality, here's the impact of hypnosis carried out in this trial and that trial and the other trial.
I always think it's great to write to GPs. I always encourage people to do that, particularly when they're first starting up, because it
Hmm.
gets your name out there, doesn't it? So if you write to them, say if it's one of your depressed people and you've done the PHQ-9 kind of standard depression screening kind of tool, and you can say, well, this at the beginning they scored this, and at the end of their sessions, after 6 sessions, 10 sessions, whatever it is, they've scored this, then their GP will think, well, that's quite cool.
Yeah. And you can interview them if you want. They'll come in and have a chat with you.
Yeah, and sometimes they they'll go back and say, can I reduce my antidepressants? Can I come off them? Whatever. And the GP will have a chat with them, and they'll say, oh yeah, well, I went to see Sue or whatever, or whoever, and we did some hypnotherapy, and it was great. And obviously, because you've sent a letter to the GP, they know. And sometimes, depending with depression, I quite often, depending on how severe the depression is, I quite often write to the GP and say, is it okay? Or I do quite a lot of work with some psychiatrists anyway, so I normally ping them an email and say, I'm going to do some hypnosis, is that okay with you? And they'll just say, yeah. So that's okay. But it's just about, it's kind of marketing really, isn't it?
It
In a
is. Yeah. So what you're basically saying though in that is to establish relationships
Yeah,
through with the medical profession in your own area by going, look, I'm here and I'm working with this and I use these tools and here's the research.
yeah, yeah.
And if there's a client I'm worried about, I'm just going to ask your permission first or whatever that may be.
Yeah, 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 that's what I tend to do. And sometimes, I do the little bit about, I'm seeing a patient, da 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 da, and then sort of in the footer bit at the bottom, there's a little paragraph about the most up-to-date research in the
Okay.
thing.
Okay.
You're lucky if they read the clinic letter because they don't have time. But once upon a time, when I first qualified as a psychologist, I'd probably sent them about 3 pages, and then you realise actually nobody has time to do that. So it's
No,
just really
no.
small
Yeah,
bullet point.
we know how busy the medical professions are. I mean, the clinics around here, I think the doctors aren't even taking people on at this stage. They're just so,
Which are so busy, aren't they?
yeah, it seems to be busy. It is, but it goes to show you the need that exists for the services that we provide.
Absolutely. And I think it is time that the medical profession perhaps looked a little bit outside the box, and at hypnotherapy as a more acceptable tool, or a different intervention that they could use as
Yes.
part. Yeah,
Yeah,
absolutely.
and the question really is, and I suppose that's why I'm asking is in terms of how that might happen. And obviously engaging with them is one thing, and just yeah, it's the one-to-one relationships, but then there's obviously they will feed that in over time, but it's a time-consuming exercise into the national bodies.
And I think, your clients, your patients are your best advocates, aren't they?
Yes, absolutely.
They-
Absolutely. Yeah. Um, so you set up your own practice in what you said 7 years ago?
yeah, about that. Well, I was working in the NHS, and then I decided that I was going to leave, but it was hard to leave, so it took me about 2 years to
Right,
decide.
okay. There's
Work
that whole safety thing, isn't there?
institution
When you were doing your research, was that when you were with the NHS or subsequently?
with the NHS, but it wasn't about hypnotherapy. It was about pain and culture.
Okay.
Yeah, it was looking at different groups within the UK and the Leicester population. So it's looking at the South Asian population versus white UK British population, and looking at their pain beliefs and whether that impacted on their attendance at pain clinics and things like that. But actually, it didn't, because
You didn't? All right.
no, because the group that we interviewed were probably more acculturated. Um, Whereas the people that I was seeing in Milton Keynes at that time were more recent immigrant populations. So there was quite a big difference there. But because I was doing my research in Leicester, it had to be in Leicester.
All right, okay.
But it was,
And
but it
did
was,
that surprise you?
I think it surprised me because I hadn't worked as a clinician as such in Leicester, whereas I had in Milton Keynes. So
Right.
it did surprise me. But then thinking about it rationally, and the more I chatted to a whole variety of different people, I just thought, yeah, this isn't really a surprise, is
Okay,
it?
they've been here longer, so they're more culturalized. Yeah, okay. Okay. Um, and how, I mean, did anything come up about people's beliefs about pain that would have helped them in their treatment or delayed their treatment if their belief that they had about pain?
Think some people there's always a group of people who believe that they're never going to get rid of their pain, or they're never going to be pain free, which for some people is true, absolutely. But some people, their belief systems, or what maybe what's happened to them, because the one interesting thing about working with pain is often not the issue, is it?
No.
It kind of goes with it. So
Yeah.
sometimes it's beliefs not necessarily about the pain, but it's beliefs about what's perhaps happened to them in the past that they're kind of hanging on to, and feel that they can't let go for whatever reason. And so sometimes if we can let go of that, then that's quite helpful. It could be some people are, anxiety is kind of fueling their pain because they're kind of stuck in the benefit systems and all of that kind of thing, which is difficult to navigate at the best of times.
Yeah.
So there's a whole load of sort of other factors. So it's not like I say pain isn't always the issue, is it? It's always other stuff that makes it so fascinating to work with.
So when you're dealing with clients, do you find that depending on their belief on pain de determines the length of time for them to get the results they want?
And not always,
Not always. Okay.
because I sort of say to people, well, come with an open mind and see what happens.
Okay.
Favorite line, see what happens. And I just say, just be open minded. Let's see what happens. So obviously, I guess because I'm a psychologist, I do quite a detailed assessment. So
Yeah.
look at beliefs and stuff, and those kind of things, and their social history, because often who's at home will play an impact
Yeah.
on what they
Absolutely.
up and shape their beliefs about pain, whether they can let go of their pain. Just look at that, look at all the kinds of different treatments that they've had in the past, and what's worked, what hasn't worked, whether they thought they might work or not. So yeah, like I say,
Multiple factors, basically.
I just go see what happens.
Yeah, no, absolutely. But you are getting the results, and that's the part. Um,
We see what happens, because by the time they come to sort of pain psychology, everyone's kind of exhausted a lot of the medical traditional kind of interventions, and they haven't really been successful. So they kind of think, oh,
So you're getting the I've tried everywhere else and I'm here now. We're all far too familiar with that, aren't we?
And yeah, and I used to say when I worked in the NHS, if we saw these people sooner, they wouldn't be off work for years before they eventually got to a pain clinic. If we could see them much sooner and get things moving for them and get their lives back on
Mm.
track, it would be quite beneficial to society as well as to, I think.
Absolutely. And that is one of the demystifying components of conferences, that not just Dublin, but not just the Irish one, but all the conferences everywhere in the UK, the US, Um, the your talk is reversing the negative spiral using hypnosis to manage depression.
Yes.
And do you want to just give people a little flavor of that? Just a little flavor, not too much now.
Spoiler alert. So what I'm going to be talking about is sort of understanding depression. So we're talking about, what actually is it? Um, Obviously, because I've already talked to you about evidence base, we're gonna talk about the evidence base behind um, therapy as a
Mhm.
tool for helping people with depression. We'll talk about the different sort of strategies to break that cylindrical nature of depression, because it
Right.
is, once you start, it kind of goes like this, doesn't it? The more negative you think, so it's how can we stop at any point in that cycle spiral to move up again.
Yeah.
So we'll also talk about methods to sort of interrupt those negative thought patterns and sort of promote positive changes, but not necessarily, using hypnotherapy. Yes, we'll do that, but it'd
Yeah.
be other things like encourage them to go out in the sunshine and go for a walk. It's
Absolutely.
small things. I sometimes think that, because psychology, hypnotherapy is so vast, isn't there? There's so much stuff. But sometimes we just have to keep it really simple and achievable for our patients, clients to move forward. Because I think sometimes if someone's so depressed, even if they can just do something, even however small it is, because obviously we'll talk about goal setting as well, however small it is, if they can do that, it kind of brings a little bit of hope.
Yes.
Hope. And because if they achieve something small, and we can, okay, great, well, you did that, that's great. What can you do next week? And we can gradually build them and get them going the other way up the spiral rather than downwards.
The so anyone basically who works with people who are depressed or presumed severely anxious, the same sets of principles will apply. This is a conversation that people should definitely be in attendance for. Can I ask you actually, suppressed anger, does that play a part in depression?
I think it can do, absolutely. Yes, yes. In fact, I'm thinking about somebody I'll be seeing later. So, but yes, absolutely. I do think that, because I think, we're very good at, as with the British stiff upper lip kind of thing, aren't we? That
Yes.
all this stuff happens and we kind of keep repressing it and shoving it down, shoving it down, shoving it down, and it's kind of a little like a pressure cooker, isn't it? At some point it's going to go. And
Yeah. And of course, emotions become trapped when we don't express them or when they don't flow through us. So, and if anger is one of the least acceptable emotions because it's seen as aggressive for whatever the case may be, um, yeah, for me it always gave that if people couldn't express it, it was almost like a hopelessness, which would be associated with depression. So that's why I was asking the question, actually.
I think a lot of people do have that sense of hopelessness, don't they?
Yeah,
Because of maybe what's happened to them, so because they can't change that, or they think they can't change that. Obviously, we know they maybe can change the way they feel about it.
yes.
So I think, hopelessness is one of those things with depression, that severe depression, that we can tackle, absolutely.
Okay, brilliant. So I'm really looking forward to this conversation. Um, to anyone who is thinking about going and hasn't yet decided, what would you say to them?
Wow, I'd say book your ticket now. It looks great. That to be, I've seen the lineup. There is some absolutely amazing speakers. There is just so much to learn. But what I have found is the hypnotherapy community is so welcoming and so kind and so supportive. So yeah, book your ticket. If come and chat to me if you like. Great. Look,
And I mean that's the thing. I get asked by people, I'm going as Johnny No Mates. I can promise you, nobody will leave as Johnny No Mates, and you won't be Johnny No Mates for very long. In fact, 30 seconds is probably as far as it will go. It really is an extremely supportive community. And so for anyone who hasn't as yet decided to book their ticket, then please do. Sue, I'm really looking forward to the conversation. It's going to be, and of course, because I work with it, this is a topic that I'm going to be paying particular interest in. So I really appreciate both your time this morning, and I am so looking forward to seeing you in Dublin.
Likewise, see you there. Thank you very much.
Absolutely. Guys, thank you for listening today and for watching. And wherever you are and whatever you're doing, have a wonderful day, and we will see you in Dublin on April 20th and 21st. Thank you.